I'm Paul Van Binder, the Staff Specialist for Public Health on the Gold Coast. I'm here today with Christine McCarthy, the Associate Professor at Sydney University and the Deputy Director of the National Centre for Immunisation Research and Surveillance, and we're here to talk about zoster, shingles and the vaccines that are available. Welcome, Christine.
Thanks, Paul.
How common is shingles?
Shingles is very common, Paul, as most general practitioners would know. It actually affects 1 in 5 people over the course of their lifetime. Particularly the incidence rises in those over 50, and once you get to about 80 years of age, you've got a 1 in 2 chance of developing shingles in your lifetime. So it is caused by reactivation of the varicella zoster virus. Almost everybody in Australia has been infected with that virus in their childhood. It caused chickenpox upon primary infection, then remains latent in the body and can reactivate.
Is it a serious disease?
Yes, it is. And so certainly when the acute illness occurs, there's a very painful vesicular rash, usually in one dermatome, often associated with flu-like symptoms. But what's particularly serious is that rash can go on to persist. There can be long-lasting pain associated with that rash, and that's called post-herpetic neuralgia. So in fact, that by definition is when pain lasts for more than 90 days. The pain of the acute zoster can often blend into the pain of the post-herpetic neuralgia, and that can be incredibly debilitating, cause people to lose function and lose real quality of life.
I understand the Australian government's introducing a vaccine this year.
Well, the program's using a vaccine called Zostavax, which is produced by Merck and Seqirus. That vaccine is a live attenuated vaccine, so it's actually got 14 times more of the same virus that is in the vaccine that is used for chickenpox earlier in life. So this vaccine's been specially designed with that higher virus content to overcome the antibody. We all remain antibody persistent after having had chickenpox, but it's actually the T cells that wane, and it's that immunosenescence or ageing immunity that causes our T cells to not be so strong. So what this live attenuated vaccine does is it gives a boost in T cells to then enable protection against zoster.
Right. Is everybody entitled to the vaccine?
No, well, the vaccine program is going to be ongoing for people at the age of 70. So that's the starting age to be eligible for the free vaccine. And there's going to be a short-term catch-up campaign, I think over about 2 to 3 years, for people aged 71 to 79 years will be eligible for the free vaccine.
How effective is the vaccine?
It's what we call a partially effective vaccine. So the very major clinical trial in this age group of the 70 to 79-year-olds showed that the vaccine's around 40% efficacious. And then there have been some follow-up studies in the US where that vaccine's been used, and it's around 50% efficacious against acute herpes zoster. Now, it turns out that it's probably a little bit more efficacious against the post-herpetic neuralgia. It seems that in this group, age 70 to 79, who are more likely to develop post-herpetic neuralgia than the younger group, less than 70 years, the vaccine actually retains its effectiveness. It's probably more around 65% effective in that age group.
What should GPs do if a younger person, say somebody 60 years of age, comes into the practice and requests this vaccine?
Yeah, that's an excellent question. The vaccine is registered for use above 50 years of age. So 50 years and above, there is very good data on safety, and the vaccine is effective. So the vaccine is effective both against zoster, and in the 60 to 69-year-olds, it's been shown to be effective against post-herpetic neuralgia. What we only have at the moment is a recommendation for people at a population level over 60. So the Australian Immunisation Handbook continues to recommend vaccination can be considered for anyone over 60, although it won't be funded before the age of 70. And in fact, it can be considered in people over the age of 50. But bear in mind, we really don't know when a booster dose is going to be needed at this time, and that does influence how many lifetime doses of Zostavax you may ultimately need.
So should the GPs provide it for people between 60 and 69 if they're willing to pay for it?
I think they should certainly have that discussion. It will be on a payer basis, but I think it's certainly worth providing that vaccine if individuals are interested in receiving it. As I mentioned, because the booster recommendations are not there yet, and we think the vaccine effect is going to wane off at between 5 and 8 years following vaccination. If someone's willing to pay when they're in their 60s and then be eligible for a free vaccine when they're in their 70s, that may be not so bad.
I understand there's a new vaccine coming out that's supposed to be even better. Should people wait for this vaccine, or should they get boosted with this vaccine?
My personal recommendation would be don't wait, because I do think that shingles is very prevalent and it could affect you tomorrow. You just don't know. There's no way of understanding who's going to get shingles and who's not going to get shingles. The new vaccine it's not a live vaccine, so it's just from a small protein component of the virus with an adjuvant. But that vaccine's not yet registered in Australia. That's called Shingrvax, and it's produced by GSK. And that vaccine, even when it does become registered, there's still a process for that to go through all the mechanisms that would be looking at whether it should be funded under the program, the National Immunisation Program. So that vaccine's still a little bit of a way off, and I think that although we don't have any clinical studies of using the live vaccine followed by the component vaccine, the inactivated vaccine, it's unlikely that there's going to be an issue having one now and then thinking about the other later. I'd probably go for the bird in the hand right now and go with what's either available in the program, or think about having the vaccine as a younger person if you really want to protect yourself against shingles.
That's very helpful advice. Thank you for sharing that. So the vaccine will become available later this year. General practitioners will be able to provide it free to people between 70 and 79.
That's right.
And it's available and recommended for people younger than that if they're willing to pay to make sure that they're protected as well at this point.
That's right, Paul.
Thanks very much for that.
You're welcome.